What is up, guys? I am Dr. Sean, here to talk about your options when it comes to a disc issue. Now, if you've been told in the past that you have a disc herniation, or you've been told that you have a bulge, or you have been told you have something worse like a protrusion or even an extrusion to the disc. Now, these are all terms that chiropractors, physical therapists, and orthopedic surgeons use to classify the seriousness of your disc issue. So basically, with any of these situations, you have options. As you get more severe into the protrusions and extrusions and sequestrations, you don't have as many options. Basically, anything from a protrusion down, you are 100% going to be able to find a ton of relief conservatively, meaning chiropractic, meaning stretches, meaning learning how to stabilize and strengthen muscles around your spine. So physical therapy could be an awesome conservative approach. Obviously, I'm partial to chiropractic care because I think when you can actually change the structure, you can actually dictate and you can begin to facilitate the muscles around those structures. For example, a muscle only knows how to contract, which means a muscle starts here, it knows how to contract to get shorter, to do whatever work it is. Maybe it means I'm trying to pick up my coffee and bring it to my hand. Certain muscles will shorten in order to make that happen. It's called a contraction. Now, that muscle is going to be either more able to do its job or less able to do its job, depending on where the structure of the bone is placed. So, for example, if you have a pelvic alignment that is off or misaligned or tilted posteriorly, it's going to put more stress on the iliopsoas muscle, right? So it's going to be tightening down in order to try to flex the hip. So if your hip is rotating backwards, putting you into more extension, your psoas muscles in the front are going to try to shorten in order to keep everything stable. And they're going to be fighting really hard in order to try and do that job. So again, I think physical therapy is an awesome additive to chiropractic care. I think though, just trying to work on the muscles oftentimes can be a cycle where you will work on the muscles, stabilize it, and then start feeling better, but then eventually the problem comes right back because the structure was never addressed. So addressing structure and addressing muscle, I think, is oftentimes your best bet. However, you do have options. And today I said I was going to talk about the different options and what happens when we take certain options versus others. So for example, option number one, you can do absolutely nothing about these problems. Disc issues tend to come and go, meaning the pain is going to be there for a couple days, a few days, maybe a week, maybe 2 weeks, depending on how bad. But eventually the nerve signal, the nociceptive fiber in that area will begin to just nullify its signal. So it won't continue to send you pain signals. I kind of call that what's called like just kind of dealing with it. Your body will adapt. Doesn't mean that you're better, doesn't mean that you've healed. It just means that the disc material has hardened up and began to heal itself. And you know, that problem is still going to more than likely come back. There's a lot more that goes into this. I don't want to go too sciencey with this, but at the end of the day, you can do nothing about this problem. Generally a low back issue or a neck problem, you'll have good days, you'll have bad days. The important thing to understand is it's not about it's not about if you're going to have another problem or another flare-up. It's just a matter of when. So generally you will have another flare-up. Based on my experience and the people that come to my office, if you choose not to do something about this, generally you will continue to keep dealing with it until you do decide to make a structural change or something. So option number one is not my favorite, because if you want to use the analogy, I try to use the analogy of weeds in a garden. If you do nothing about the weeds, what's going to happen? They're obviously just going to keep getting more and more weeds, right? They're going to overrun that garden, and generally they will have deeper roots. So the next time we go to try and address those problems, they're going to have more layers for us to try to peel back. So usually a little bit harder conversation, a little bit harder process to try to fix it. Option number 2, a lot of people go with pain medication. It's an option. It's out there. I don't claim to call somebody out for going this option, just because, you know, when you're in pain, you're really willing to do whatever it takes to not live in pain. Our bodies do not like pain, and so we are going to do what we can. So when it comes to taking a pain medicine, you're gonna help the symptoms only. You're just masking the symptom. Your body is giving you pain, not because it's stupid, not because it's broken. It's giving you pain as a signal so that you can do something about it. Now, same way you have a check engine light come on in your car, that is just a warning sign. You can put a piece of tape over top of that light and ignore it forever, but it doesn't change the fact that your engine has something wrong with it, and that engine piece is going to break down if nothing is done to it. Average American takes better care of their car than they do their own body. If you don't believe me, you know, we have some of the best cars in the nation, and we rank about almost dead last in overall health in terms of our health outcomes. So that's pretty astounding to me. But again, going back to the weeds analogy, if you take painkillers, which again, I'm not necessarily against it. I try to help people get away from that because it is bad for your liver, it's bad for your kidneys. So without anything else, it's really bad for you in general. But I can understand the short-term use. So if you need it short-term, 100%, I'm not going to knock you for that. I'm not going to be the guy to make you feel bad about it. But understanding that long-term use of painkillers is very detrimental to your health. So going back to our weeds analogy, taking painkillers is kind of like taking mulch and spreading it over top of your garden. Sure, the weeds look like they're gone, everything looks pretty for a little while, and then eventually what happens? Those weeds will grow through that mulch, and now again, those roots have gotten deeper, and now we not only have the original mulch to get through, we have layers of more mulch that we applied to that garden in order to get down to the bottom of the root. And what I'm saying is, you are going to think you're feeling good, and so you're going to go out into the garden and you're going to mow the lawn, you're going to pick up your kids, you're going to go do this, you're going to play basketball, go to the gym. You're going to continue to add layers of destruction to your tissues, and that is going to make it harder for me to do the job I originally was supposed to do. So painkillers, again, in the short term, okay, long term, not so great. Taking an injection into the spine, not my favorite option, because you're sticking a needle into the spine and you're actually deadening a nerve. Now, your nerves do a lot more than just pain. The University of Colorado, I believe Harvard, also did a study that said that your nerve, 15% of the nerve is responsible for pain. The other 85% is responsible for your functional information. That means your brain, for example, in your low back, is using those nerves 85% for coordinating functions of your digestive system, coordinating functions for your bladder, coordinating functions for your reproductive organs, and all the cellular functions that happen within those systems dictated by the nerves and their ability to communicate. So, if we take and deaden a nerve, you are not only shutting off the pain, you are shutting off the function. Your body is amazing, it will adapt. However, the ability for it to adapt long term, we don't really know yet. And so to deaden a nerve and turn off its function, you can 100% expect that the digestive system, the bladder, the reproductive system will function less optimally. What that looks like for you, we don't know. It's hard to tell, but I always ask people, if you put pressure or irritation or turn off a nerve, is your health going to be better or worse? And the answer is pretty obvious, I think. Surgery, another option you have. I'd say that's option number 4. Surgery, I mean, I'm not going to knock surgeons. Surgeons are brilliant. They are saving lives. They're helping people left and right. And I think when you're in a position where you need it, you need it. And so any surgeons watching this, please don't think that I'm a chiropractor and I'm against you right away. I think at the end of the day, we all understand that surgery should be a last effort. And I do honestly respect a lot of the surgeons that say, hey, we're going to do something conservative, or I expect you to do physical therapy for so long before we do a surgery. That's awesome. But how about saying, I expect you to do 6 months to a year of chiropractic care first. Let's co-manage this person so that we can work together. If a surgeon came to me and said, Dr. Sean, this person is on the door of having a surgery, but I don't think it's necessary 100% yet, can you work with me to help me save them from that process? I would love to have that relationship and that back and forth. So when surgery happens, it is basically that's the end of the road. If you're conservative, maybe you've just shaved down some of the disc that was putting pressure on the nerve. There's lots of different surgeries, but oftentimes they will shave down the disc that is putting pressure on the nerve. They will carve out pieces of the bone that is irritating or stressing the nerve. They will sometimes take the disc out completely. They will oftentimes put rods into the spine to stabilize and keep open the neural foramen, which is where the nerve comes out from the spinal cord, going down to your legs, down to your feet, carrying messages. And so that's the end goal. We want to make sure that nerve has space to operate, and if it doesn't, then we have problems. So they will oftentimes put pins into the spine in order to keep that space where it needs to go. Now, the problem with this is generally oftentimes the reason for degeneration is lack of mobility. So the disc has lost its ability to move and function and bend and twist properly. And so there is a lack of fluid in the disc. That leads to drying out, and that is degeneration in a nutshell. So if we add more immobility to the spine by locking it down with surgery, putting pins in it, those two bones will not move anymore. So the disc above that fusion and the disc below that fusion, or maybe it's just the discs above, they will now take more stress because they're trying to make up for all the motion that has now been lost. And they 40 to 50% are more likely to have another surgery needed. So again, what we do here in our office is we look to find the structural issue, what we call the subluxation, where the abnormal load is coming from, and we work to adjust it gently by putting gentle forces into the spine to put signals into the spine, into the spinal cord that go up into the brain, into the prefrontal cortex, which is right here. And it actually begins to recreate a story. It helps to teach your brain effectively where your joints belong in space and how to turn on muscles and nerves in those areas to begin to hold those adjustments longer. So, in my opinion, this is a very gentle procedure. It doesn't take a lot of effort, really, on the patient's part. They show up for their visits. We adjust them regularly in order to make that change, in order to re-educate the nervous system back to normal. And then a lot of times we will use what's called decompression therapy or disc rehydration therapy, where we will put them on a table and the table will begin to open up and pull in both directions. And what that does is allows the disc space that has been collapsed to open up and allow fluid to make its way back into the disc. And we talked about how degeneration is that drying out effect. So that fluid is full of nutrition and life-giving nutrition that the disc needs in order to stay healthy long term. So we're not claiming to grow discs back. As you get to a certain age, they're just not going to come back. But when you're young, we can 100% help to stop a degenerative process in its tracks and reverse the need for surgery, pain medication, anything like that. And more importantly, we're able to keep the natural motion in your spine that your body needs. And that's where we talk about when you age into your 80s and you're able to move, be in control of your body, be independent. That's the way we want to age. When we start looking at taking painkillers, taking nerve deadeners, or epidurals, getting surgery, we're going to start looking at not moving well as we age, and then we're not in control. And that's when we start just existing rather than thriving. So if you want to thrive, if you want to learn how to take charge of your body, take back control of your health with gentle chiropractic care, with disc rehydration, with healthy movement, with nutritional changes, let us know. Let us take care of your body. We are here to help. in every way we possibly can. So like this video, follow, subscribe, share, and looking forward to talking to you guys next week.